Greta McLaren, and I'm at my clinic, Skin Secrets, and as most of you know, I specialize in liposculpting. I've been doing this for years. I truly feel it's an art form and can change people's lives, but I think you do need to pick a doctor who really has an artistic eye for this. Today, this patient has been so kind to consent for us to video this, and she is my typical patient with the most beautiful little figure, but she's not very tall. She's like 5 feet 2 inches, 5 feet 2, something like that. And so her thighs, she's the girl that has the tiny little waist where the outer thighs are bigger. And she was born that way. And all these patients, I can ask them, did you have to wear, jeans or pants that were too big around your waist to fit over your hip area when you were a teenager? And the answer is almost always yes. Because this type of a patient, just genetically ours, has the smallest waist. And then the outer thighs go way out. Now, I'm all about curves for the buttock region, like everybody wants to have a curvy tush area. But you want it to curve this way, not this way. Out, it gives you a wide-looking behind. That's your thighs. We leave the curve this way. And when I do lipo on the outer thighs, it actually makes you look curvier. So I already marked her, so we're going to have her take her robe off. Okay, you can see the way I marked her. So she's got that tiny waist I was telling you about, okay? And what we're trying to do is take this fat off out here and taper it. And then we're trying to leave her with this round-looking butt that looks even curvier this direction, because I'm not taking any off of here or here. I'm only going to take it off out here. And then I'm going to do a little bit on the inner. So the whole idea behind this is to give her a more curvy, rounder looking behind. And so we're going to videotape this and then fast forward and show the before and after. See, everything is done sterile. And this is JR, and she has been given something similar to Valium. It's actually called a Halcyon. I can also use Valium or Xanax. And then she's just been given a Vicodin. So the idea is that you're not necessarily asleep during the procedure. Some people fall asleep, but it's so tolerable that I've had people literally sing a song to me, tell me jokes. Everybody's different, okay? So how are you doing so far, JR? Good. Okay. So now this is the numbing. This is not even a needle. This is just a probe. And if you look at it, it squirts out salt water and lidocaine, which we've got hooked up here. So the whole idea is to put the numbing in everywhere, and then when we melt the fat, it'll go into that numbing solution. It'll be like a fat soup. So I'm going to start running this. And it's a little bit spicy, but it's pretty tolerable. Are you tolerating this okay? Mm-hmm. It's actually very fast to do this. And she can feel it a little bit, but then pretty soon the whole thing is just numb. And because this is an outer thigh case, I'm doing her outer thighs, and I'm going to do a little bit of her buttock area here, and then we're going to start melting the fat with the vaser. So I'm going to do her whole leg like this, and then we're going to just do the other side. Okay, so now we've put lidocaine, salt water in everywhere. And now this is called the vaser ultrasound, and this is, to me, the most effective tool to use for melting the fat. We also have Smart Lipo here, but this works by ultrasound and bubbles, and what it does is it separates all the fat cells. So all the fat cells are separated into this saltwater and lidocaine, so it's like making a fat soup. I always say it's like shaking all the apples off of the tree. Those are the fat cells, and then they're floating around in here. That is the art of liposculpting, because then when I go to suction this, I'm not having to just rotor root out and suck out fat. It literally comes out like a soup. You'll see that. So I'm able to sculpt and shape her exactly the way I want it. She can hear this, but she won't feel it. So we'll turn it on and we can ask her, but she will not feel any of this now because I'm just melting the fat. so now we're ready for the suctioning. So I put lidocaine and salt water and I melted all this fat. It's like fat soup. She's actually sleeping, but I can wake her up at any time. That's what you need to know about this. It's a very safe procedure. Judy, you doing okay? See, I can wake her up at any time and ask her how she's doing. That's why it's so safe to do this in the office. There's no general anesthesia or drugs that are harmful here. It's all oral. And now this has a little suction, and it's going to go in right here. The fat. Sometimes the patient likes to see that, so I let them watch. Now this is the true art of liposculpting. It's not how much fat you take off, it's really how much you leave behind. You need to leave enough fat behind so that it still cushions the skin, and you need to shape this area correctly. If you don't, then you'll end up coming to see me for me to fix it. So I'm just going to say, you want somebody experienced in liposuction who does at least over 1,000 cases, probably 3 to 4 cases per week, probably up to at least 12 to 20 per month and 4 years. And I'm being very serious about that because I've been doing this for over 12 years, and it really takes a lot of cases to have an artistic eye and be really good at shaping and knowing how much to take off and how much to leave behind. I personally think inner thighs are my favorite case and that they're the easiest case to do because it's not a weight issue at all. It's really a genetic issue where you're just out of proportion to the rest of your body. So no amount of diet and exercise in the world is going to take this off and put it in proportion with your waist again. The only way to get this is with liposculpting. So I'll do a few here, and you can see pretty soon the fat's going to go into that canister. She's probably going to be 300 at least, 300-400 cc's that come off of one